aren't the urinary neurotransmitter tests inaccurate? Okay. They're not inaccurate. They're combined. So the normal question I get is, it's not central nervous system. That's true. If you want to get central nervous system neurotransmitters, you either have to do a lumbar puncture and get cerebral spinal fluid, or whittle out a piece of the brain. And I don't think you want to do that in your office or anywhere. But utilizing the urinary, serum, or platelet neurotransmitter levels, which are all coming from the serum, okay, is a mixture of peripheral, central nervous system, and wherever else you get your neurotransmitters. But the pattern never changes, okay? And that's true in organic acid testing and a whole mess of other things. The pattern doesn't change. Even if it's high or low, the pattern is definitely there. And you can make decisions on that. So when I'm lecturing in person and I have a bunch of psychiatric professionals, vying with me, I look at them and say, listen, how are you determining what somebody should take? Well, they're listening to symptoms. How accurate are the symptoms? Oh, they have depression. Does that mean they automatically have serotonin deficiency? It could be a dopamine deficiency. It could be any kind of neurotransmitter imbalance. So here's what happens. You go into a doctor. You say you have depression. All right. They give you an SSRI, something like Prozac or whatever. All right. And you take it for a month. It's not working. So they double the dose. Okay. Another month. It's not working. So I'll switch over to something else. Another SSRI. Month, 2 months. Now we're at 4 months. Maybe it's something else. Okay, maybe they'll give you something like Wellbutrin, which is an SNRI, raises norepinephrine, and SDNRI raises dopamine, And if all these trials, and it's going to take about a year, all right, aren't working, then they're going to send you off to the psychiatrist who's going to start using atypical antidepressants, which affect a lot of different neurotransmitter receptors. Okay? I'm not saying this is bad. I'm saying this is the way that they're doing it, because that's the way they were taught. I never yell at somebody for doing what they've been taught. Okay. If they had the neurotransmitter test, they'd have a better starting point, a more accurate starting point. So when someone gets really obstreperous with me, and I go through that example, I said, at the end of it, I say, you're guessing. I'm not. You're guessing. I'm not. I can shorten that time. Even if I were using medications, I would still use the neurotransmitter test. I'm shortening that time where that patient will get benefit. Okay, instead of waiting 6 months to a year before you trial and error the right combination of medications, this will give you a heads up on what the real balance is. Okay, and sometimes it can get confusing, but that's why you need a practitioner to do it who's really familiar with it and has had a lot of experience. Okay, so are they inaccurate? No. What's inaccurate is the interpretation of them. Okay, you have to know how to interpret them. That's the whole thing.